Hello. TMJ, or the temporal mandibular joint, is the hinge joint connecting your jaw with your head. Smooth TMJ function is essential for chewing and speaking. Jaw pain, neck pain, jaw clicking, and joint locking can all be signs of TMJ dysfunction. TMJ dysfunction can cause muscle knots, a stiff neck, shoulder pain, and difficulty opening or closing your mouth. TMJ dysfunction has also been associated with grinding or clenching of teeth, which can lead to tooth damage and further joint problems. TMJ dysfunction can be a temporary inconvenience or a recurrent problem. Physical therapists and chiropractors use myofascial release and trigger point therapy to relieve TMJ problems. Dentists use splints and night guards. Medical treatment focuses on medications, injections, and surgery. Fortunately, several clinical studies have shown that stimulating certain acupuncture points can be a safe, effective, and simple option for treating those with TMJ symptoms. Acupoint stimulation can be used alone or in conjunction with other treatments. In the next few minutes, I'm going to show you how to locate and activate 3 acupuncture points for TMJ relief. Of the 3 acupuncture points that I'm going to show you, the third one is the most powerful. But it's recommended that you use the first and the second ones to prepare your body for the deep effect of the third point that I will demonstrate. My name is Dr. Barretts. I'm a chiropractor, nutritionist, herbalist, and I'm certified in acupoint physical medicine. I've helped thousands of people live better naturally, and I want to help you too. If you like this video, please give me a thumbs up, subscribe, and hit the bell icon to be notified when more videos like this come out. The first point I would like to demonstrate is lung 7. Lung 7 is known as broken sequence because of its reputation for stopping recurrent problems such as TMJ dysfunction. In addition to preventing and treating TMJ dysfunction, lung 7 is said to strengthen the lungs, so it is used for asthma, bronchitis, allergies, cold, and flu symptoms. Lung 7 is found on the lung meridian. The lung meridian starts in the groove between your shoulder and your body. It then goes up to your shoulder and then down the inner part of your arm, just like this, till it comes to the tip of your thumb. The lung meridian has internal connections with the stomach, the intestines, and of course, the lungs. Lung 7 is located just above your wrist on the thumb side. To find lung 7, locate your wrist crease right over here, and then find the spot that is just under your thumb right over here. Now find the point that is the width of 2 fingers below that, just about here. Push in to find a point that is sensitive, sore, tender, or painful. That is lung 7. Activate lung 7 by rubbing the area quickly 5 times. Take a break for a count of 5 and repeat 4 more times. It might look like this. Or if you have a tei shin, gently use it like this. During or shortly after activating lung 7, you may notice a sensation of heat or energy in your thumb, hand, arm, chest, stomach, or belly. This indicates a deeper level of healing. It may take several sessions for these sensations to develop. The next point to reduce the frequency and severity of TMJ dysfunction is large intestine 4. Large intestine 4 is known as joining valley, which gives a clue to its location on the back of your hand. In addition to relieving TMJ symptoms, large intestine 4 is said to sharpen and activate the senses of vision, smell, sound, taste, and touch. Large intestine 4 is like a pharmacy in your hand and has been used to relieve pain and stiffness in the hands, address insufficient or excess sweating, and relieve inflammation in the hands, arms, chest, neck, or head. Large intestine 4 is sometimes used by acupuncturists to induce labor when pregnancy is overdue, but it is not recommended for use during the regular course of pregnancy. The large intestine meridian starts near the tip of your index finger, travels up your arm, along the outside of your arm, just about like this. It then crosses over towards the front of the neck, up over the jaw, and then interestingly it crosses under the nose to the other side. It's the only acupuncture meridian that actually crosses the center line of your body. The large intestine meridian has internal connections to your lower jaw and your large intestine. To locate large intestine 4, look at the back of your hand. You might want to move your thumb towards your finger and back again. You'll notice there's a groove of flesh between your thumb and your hand. At the base of that groove, push in towards your hand and find a point that is sensitive, sore, tender, or painful. That is large intestine 4. Activate large intestine 4 by rubbing the area quickly 5 times. Take a break for a count of 5 and repeat 4 more times. It might look like this. Or if you have a Tei Shin, it might look like this. Now locate and activate large intestine 4 on your other hand. During or shortly after treating large intestine 4, you may notice a sensation of heat or energy in your index finger, your arm, your shoulder, your cheeks, your jaw, or your belly. This is called Da Qi and indicates that the treatment is getting deep into your system. It may take several sessions for Da Qi to develop. Once you have activated lung 7 in large intestine 4, you are ready to activate gallbladder 2. Gallbladder 2 is located near the ear. It is known as meeting of hearing. In addition to helping with TMJ symptoms, gallbladder 2 is said to sharpen hearing. Gallbladder 2 is traditionally used to reduce ringing in the ears and to treat facial pain. Gallbladder 2 is found on the gallbladder meridian. The gallbladder meridian is quite long. It has 44 acupoints on it. The gallbladder meridian starts right over here next to your eye. It goes over to the ear, sweeps up over and behind the ear, then sweeps forward again right here above the eye. It then sweeps back up again over the head all the way down the neck. Because of this sweep over here, it's often used for migraine headaches. The gallbladder meridian then comes down, crosses in front of the shoulder, and then in a zigzag pattern works its way down to the pelvis. From the pelvis, it goes to your hip, right over here, then runs down the side of your leg, and then over the top of your foot, ending on the tip of your 4th toe. The gallbladder meridian has internal connections to the liver and the gallbladder. To find gallbladder 2 on your left side, notice the small flap that is just in front of your ear canal. That is called the tragus. Next, put your finger just in front of the notch that is below the tragus. Now, open your mouth. Press in and find a point that is sensitive, sore, tender, or painful. That is gallbladder 2. This is a sensitive area and gentle treatments are best. Activate gallbladder 2 by gently rubbing the area 5 times. Take a break for a count of 5 and repeat 4 more times. It might look like this. Or if you have a Tei Shin, it might look like this. Now find and activate gallbladder 2 on your other side. During or shortly after activating gallbladder 2, you might notice a sensation of heat or energy in your eye, your ear, the side of your head, or anywhere else along the course of the gallbladder meridian. This is normal and therapeutic. Repeated treatments deepen results. If you are having TMJ pain, clicking, or locking, I suggest that you activate lung 7, broken sequence, large intestine 4, joining valley, and gallbladder 2, meeting of hearing, 3 times a day for 2 weeks for initial relief. Then use these points as needed thereafter. And if you know someone who is having TMJ pain, clicking, or locking, I encourage you to share this video with them. It is intended to give them relief and just might change their life. Thanks for watching. Till next time, this is Dr. Barrett signing off. Yours for health naturally.